First of all, I have several family members, aunts, uncles, cousins who are in healthcare, specifically nursing, and so that was always kind of an interest of mine. I was always interested. As soon as I got into high school, I had a really engaging biology teacher, and that got me interested in biology and study of the human body, which I'm still interested in. Obviously, I deal with it every day. And then I had a surgery when I was a sophomore in high school. Really got the chance to sit down and talk with the anesthesiologist who delivered my anesthesia, and was very interested in that side of things. And that interest continued. I was a nurse for several years after undergrad. Always kind of had anesthesiology in the back of my mind. I was fortunate enough to get into anesthesia school, post-grad school on my first attempt, and so started my training and never really looked back from there. My role here at Reedsburg as an anesthesia provider is we see all of our patients. Patients that come in for surgery, we do a pre-op evaluation on them, usually in the computer, and then we go see them in the preoperative area and do our own physical assessment. We answer a lot of questions and overall just alleviate any fears, anxieties, answer any questions that they may have. And we also are on call to place labor epidurals for moms who are in labor. So if any moms are in pain, labor it can be a very long, arduous process, and so we will go place labor epidurals to help provide labor analgesia for any moms upstairs. I would say the most rewarding thing in my career would be just the ability to help patients in a very stressful, vulnerable time. They're coming in because they need to be here, whether it's an elective surgery or something that's not elective. And just the ability to help them through the procedure, through their hospital stay. Obviously in our field, we treat pain a lot, and so the ability to make patients comfortable and get them through surgery, get them through labor, whatever it is, and just to be able to see them on the other side and see that they made it through, they're comfortable, they're doing fine, and everyone is safe. I chose RAMC. I like the fact that it is a small community-owned hospital. In my training, I had rotated from through every size of hospital, from extremely large down to smaller than RAMC, and I like the size and the fit at RAMC. I'm one of 5 anesthetists here in the department, and so that's a pretty good number. I like the fact that it's in a medium to small size town. My wife and I both grew up in small towns, and RAMC was just a good fit. You get to know your coworkers very well, and you get to be a good cohesive unit. Outside of work, I have 3 kids, and so spend a lot of time with them. My wife stays at home with them, so she is very busy. And the kids like to do anything outdoors, and so Wisconsin is a great place to live for that. The summers are very comfortable here, and so we spend a lot of time doing outdoor activities. I have a boy and 2 girls, and so they're very active, riding bikes and just playing with other kids in the neighborhood. My daughter loves to fish, and so we take her fishing, that type of thing. Hiking as a family, we like to do, getting all 3 kids out there. In the winter, I grew up skiing when I was young, and so skiing around here will be fun. We like to get out to the lakes. We lived in Hawaii for a period of time, and so the kids love beaches, they love sand and being out in the sun. I like to cook and grill quite a bit, so I take a little bit of the pressure off my wife on that on the weekends. And we still like to go back and visit family back in South Dakota, so we do make trips back there. And overall, just like to spend time outside.